We'll go ahead and get started. So, hello everyone, and thank you for joining us today for this webinar in the Licensor Professional Development Series. I'm really glad that you're here to join us today, and we'll start with introductions and housekeeping. My name is Tracy Chestnut, and I'm a quality assurance consultant with the National Center on Early Childhood Quality Assurance. I have the pleasure of facilitating this session today in the Licensor PD webinar series. I would like to thank my colleagues from the quality assurance team, Amy Page, Ashley Boyle, and Jean Van Orsdal, who have assisted with the development of the session, and they're also assisting with the call today. Today's session is being recorded and will be made publicly available along with a slide deck on the Quality Center's webpage once the remediation process that is required for accessibility has been completed. Due to the large number of participants today, we do have you all placed in listen-only mode, so we don't have any accidental interruptions. We're all getting pretty good at this, but it still happens. So we do want you to be engaged today. So you can do this by using the chat feature, which most of you have found. If you haven't already found it, it's in the bottom of your screen. And if you don't see it, you may have to click on the More section where you see the three dots to get it to open on your screen. Please reach out via chat if you're experiencing ongoing technical issues during the session, and we'll try to help you. However, please note that we may have limited capacity to address issues while the webinar is running. If you experience audio or technical difficulties during our session, please try logging back in to see if that resolves the issue. Today, we are joined by my two colleagues from the Quality Center, Ashley Boyle and Jean Van Orsdal, who are going to present on health and safety guidelines, standards, and requirements. After their presentation, I'll talk a little bit about the upcoming community conversation. That is kind of the second part of this session, where you'll have the opportunity to talk directly with your colleagues about the content we learn about today, and then we'll close this session. Certificates will be issued for those who attend the full session today. When we issue the certificates, we will use the email you provided when you registered. With that, I have the pleasure of turning it over to Ashley and Jean.
Thank you so much, Tracy. I'll go ahead and introduce myself. My name is Ashley Boyle, and I work with Tracy and Jean at the National Center on Early Childhood Quality Assurance. At the center, I am a technical project specialist focusing primarily on health and safety, and I also I work on some projects related to workforce development. I'll pass to Jean so she can introduce herself.
Hi, everyone. My name is Jean Van Orsdal. I am a quality assurance specialist with the center, and I work on health, safety, and well-being as my areas of expertise. And I also am a Region 9 liaison. So I also work with states and territories within Region 9. So I'll pass it back to Ashley.
Okay. Today, we'll be covering here's some of our objectives. We will explore how to support implementation and movement toward best practices to help children and families thrive. We will consider what health, safety, and well-being regulations and standards are working, and what has been the hardest for providers to implement over the past few years. We will also support participants in exploring the implementation of health, safety, and well-being guidelines, standards, and requirements for childcare providers. And lastly, we'll share experiences of technical assistance versus monitoring. Now I'm going to set some context before we dive into the rest of the presentation about what it means for children and families to thrive. So when we talk about thriving, what is it exactly that we mean? We'll spend some time over the next couple of slides explaining that concept. So to help us understand what allows children and families to thrive, let's look at the ecological model of health and well-being. So the model on your screen shows that our health and well-being are affected by many different factors. So for example, if you live in New York City, you might walk to get your healthy groceries. But if you live in a small town, you might need transportation to get healthy groceries. So right now, we're just going to look at how these different layers impact thriving in more detail. First, we'll look at the innermost rings, the interpersonal and individual levels. That includes the 8 dimensions of wellness. So over the years, public health researchers have created several models to describe health and wellness. And these models help us understand broad topics by breaking them down into specific parts. One of those models is the 8 dimensions of wellness. When we talk about wellness, we mean how we live in our wellness is about how we live in our lives and the joy, fulfillment, and health we experience. In 2016, the Substance Abuse and Mental Health Services Administration, SAMHSA, provided some guidance on wellness and how it covers many areas of our lives. And these areas include emotional, spiritual, intellectual, physical, environmental, financial, occupational, and social. These areas are connected and affect each other. So, for example, if you are worried about money, that incorporates your financial wellness, but your physical health might suffer too. And that's just one example of how each of these rings is connected. The 8 dimensions of wellness help us understand how different aspects that affect our well-being. So they also consider other factors like race, gender, ability, sexuality, trauma, and personal beliefs. But how does wellness relate to thriving? Wellness is about maintaining good health and well-being in different areas of life, like physical, emotional, and social aspects. It's really about living a balanced and healthy life. Thriving, on the other hand, goes beyond just being well. It means reaching your full potential and flourishing in all areas of your life. Thriving involves not only maintaining wellness, but also growing, excelling, and feeling fulfilled. We're revisiting the model we introduced at the beginning. So now we're going to look at these outer levels, which is the institutional, community, and interpersonal levels. Okay, so while the 8 dimensions of wellness mostly focused on individual and interpersonal factors, the social determinants of health look at the bigger picture. This is another public health model. The social determinants of health are the conditions in the places where people are born, live, work, play, worship, and grow old that affect health and quality of life. The key factors are access to and quality of education, access to and quality of healthcare, your neighborhood and built environment, social and community connections, and economic stability. Healthy People 2030 is a national initiative that sets health goals every 10 years. In 2020, which is when Healthy People 2030 was created, and so in 2020, it made the social determinants of health a priority, shifting focus from just wellness to overall well-being and thriving. So now that we've looked at these two models, the dimensions of wellness and the social determinants of health, let's think about what it means for children and families to thrive. Thriving means reaching their full potential for health and well-being throughout their lives. Thriving in childhood involves many factors, including individual traits, family, community, and environment. And when we consider how individual traits are influenced by the social determinants of health, we get a more complete picture of what it means to thrive. So today we'll use this framework from the American Academy of Pediatrics as our guide. Achieving wellness, which is toward the top of the screen, is influenced by the social determinants of health. And then you can see that the social determinants of health is underlined by racial justice, equity, and inclusion. Also part of this, within the context of what we're talking about today, we can think about the quality of childcare programs, access to a pediatrician, is health information in the family's language, do they have health insurance, do they have access to screenings, are neighborhoods safe places to walk, are there playgrounds or green spaces, and we should consider if there are any environmental hazards like lead or asbestos. And then other factors like parents, whether parents can afford baby supplies, if the family moves often, which can be very stressful, and if they can afford nutritious food. Those are just some examples of other factors that play into these things and could be incorporated in their social determinants of health, which affects wellness, and then for thriving. So this framework, what we really want to say, the bottom line is that it shows how the entire system is then also affected by racial justice, equity, and inclusion, and each of these factors are interconnected. We have one more model to show you before we talk about the licensing context, and that's that this is the outermost level. If you remember on the ecological model that we showed you at the beginning, the outermost level said policy. And this is really your point of intersection. So throughout childhood and adolescence, children depend on their family for guidance, protection, and support. The nurturing care that children receive early in life provides the basis for responsive relationships throughout childhood, adolescence, and beyond. These relationships are based on trust, mutuality, and respect. So this includes childcare centers, home-based childcare, and family friend and neighbor care. Children need healthy and safe caregiving environments that support their social and emotional development. The care provided in childcare settings is shaped by licensing standards and regulations, as well as CCDF requirements. And that's where you come in. So now I'm going to pass to Jean, and she's going to talk about the licensing context.
Great. Thank you so much, Ashley. I appreciate it. And thanks for setting the context. That's really helpful. Now, we would be remiss if we didn't talk about the changes over the past decade. In 2014. The Child Care and Development Block Grant was reauthorized and amended. CCDBG governs the State and Territory Child Care Development Fund, or CCDF, which is provided to states to implement child care programs for infants through 13 years of age from families with low incomes. This final rule expanded the program to emphasize child development and high quality care. As you know, because of this expansion, all states and territories must establish health and safety standards, provide training, and monitor all providers receiving CCDF monies on these health and safety requirements. States and territories have flexibility in establishing these standards and the training to support them. The 2024 Child Care and Development Fund Final Rule updates regulations to help working families afford child care and broadly support child care quality and accessibility in communities. Policies included in this final rule are designed to lower child care costs for families, improve payments to child care providers, increase child care options for families, make enrollment easier and faster for families, and increase clarity in CCDF requirements. So as we look at this next slide, we see, as identified by multiple sources, the core purpose of child care licensing includes, first of all, ensuring health and safety. Licensing sets minimum health and safety standards that child care programs must meet to legally operate. This includes requirements for sanitation, emergency planning, building safety, staff training in areas such as CPR and first aid. The second core purpose of licensing is providing safe supervision. Licensed child care programs must maintain appropriate staff-to-child ratios and ensure that caregivers are qualified and receive ongoing training. This helps ensure that children are safely supervised and receive the attention they need. Third is supporting child development. So licensing requirements often include standards that support children's development and learning, ensuring that childcare environments are conducive to growth and education. The fourth is monitoring and compliance. Licensed programs are regularly monitored to ensure that continued health and safety standards are met. This ongoing oversight helps maintain a consistent level of care and safety. And fifth is accountability. If there are concerns about a licensed child care program, parents can file complaints, which are reviewed by typically licensing staff. This system of accountability helps address and maintain high standards. So, you have a different slide than I do. As we think about standards for childcare, these terms often get used interchangeably: standards and regulations. As we think about standards for childcare, they can be viewed along a continuum. In our discussion today, we will use these definitions. A standard is a statement that defines a goal of practice. It differs from a regulation in that compliance is not necessarily required for legal operation. So at the bottom of the pyramid, we have caring for our children basics. These are minimum health and safety standards. Above this, we have licensing requirements and regulations. These ideally would be built off and include all standards in basics. Above licensing, we have the Head Start program performance standards, state-funded pre-K, quality improvement systems, and accreditation. And finally, at the top of the pyramid is best practice, the full set of caring for our children national guidelines. Licensing requirements are mandatory to operate legally, prevent harm to children. When we think about the program, funding, and quality standards, we're thinking about things like Head Start program performance standards, which are required in order to receive funding. And the state-funded pre-K standards are as well. When we think about quality improvement systems, those are typically voluntary, and they're indicators of levels of quality of childcare. Then there's the best practices standards, research-driven and evidence-based, voluntary. These promote optimum health and safety and child development. So let's look at caring for our children just a little bit closer. So caring for our children, health and safety standards. We talk about 3 different levels typically with caring for our children. And caring for our children basics represents the minimum health and safety standards. If we think back to the previous slide, we remember that that's even below licensing, right? So these are the minimum health and safety standards that experts believe should be in place where children are cared for outside of their home. Stepping Stones to Caring for Our Children, which has 138 health and safety standards, is a collection of selected caring for our children standards, which when put into practice are most likely to prevent a serious adverse outcome in childcare or early education settings. So when we used to talk about stepping stones for caring for our children, we talked about morbidity and mortality. And I remember the first time I ever heard this, I was like, what? What does that mean to me? What do I need to know about this? Well, stepping stones is supposed to be the set of standards that prevents a child from being harmed in care or having an unhealthy lifestyle as a result of being in childcare. So reducing the chance that they would be hurt or even worse, die in care, and also to support a healthy lifestyle. These are the standards that are recommended by the experts. At the top of the 3 levels, we have caring for our children. And caring for our children is over 700 plus health and safety standards. So that is a lot of standards. It is a collection of national standards that represents the best practices based on evidence, expertise, and experience for quality health and safety policies and practices for today's early care and education settings. Now, these documents are always in revision. If you were to go to the Caring for Our Children website, you would find that they put the date that they update each of the standards. Caring for Our Children Basics, which was published in 2015, is undergoing revisions currently. So if you're interested in learning more about the full standards, for example, you want to understand the evidence that's cited for a best practice. Why is that what they picked for best practice? Or the rationale behind a standard? You could go to the website. Next slide. The full standards from Caring for Our Children can be found at nrckids.org, and you will have this URL when you get the PowerPoint set after this is over. So you will be able to click through. But the full standards are available on Caring for Our Children. And you can also see, so you can't see it very well on this slide because it's so little, but this is first aid and CPR training. And it specifically shows you a little tiny footprint, which means that it's part of Stepping Stones. And there's a notepad next to that footprint, and that means that that's been updated. So you can hover over that to find out the date that this standard was last updated. There is a rationale in here. There are comments, the type of facility that this is applicable to, and also related standards. And then under the related standards would be the references for the evidence base for this particular standard. So let's look at some standards in action. I was once a director of a child care center, and I had to learn on the job what my role was. And I had the most amazing licensing person who helped me learn how to understand the licensing regulations in the context of being a director of a center. And so each one of those standards is based on each one of those things that you have in your licensing regulations is based on things that we know are good for children. And so we're going to talk about safe sleep. We're going to dig a bit deeper. We're going to use this safe sleep to look at best practices, standards, licensing requirements, and how they align. As we think about the implementation of safe sleep practices, are there barriers that you face in the implementation of the best practice? If so, what are those barriers? How does this standard support children and families? Write these things down, and you'll have an opportunity to discuss this further tomorrow on the community conversation. So let's look at the Safe Sleep Practices Standard. Now, this is kind of different from what you may have seen in the past. In 2022, the American Academy of Pediatrics updated their policy statement on safe sleep practices. And in that, they specifically spoke to what caregivers should do if they are caring for a child under the age of 1 year. So the standard, which has been recently revised to align with that policy statement, includes a lot more information than it did in 2015 when we had the last version of Caring for Our Children Basics, where the standard, all it said was it said all staff, parents, guardians, volunteers, and others who care for infants in early care and education should follow safe sleep practices as recommended by the American Academy of Pediatrics. Cribs must be in compliance. That's pretty brief. We have now expanded the standard to include all of the components that were in the 2022 statement. So some of these things may look new to you. You can see on the slide that there are lots of recommendations. As we walk through these, think about the ones you currently have in your state or territory. And I thought I saw somebody raise their hand. And if you have a question or a comment, unfortunately, the only way to share it is to share it in the chat. So if you could share it in the chat, then we will have that and we can follow up on that. Okay, so the first one, always place an infant on their back to sleep for naps and at night, back to sleep every sleep. So it's 17 times more likely that a child could I don't want to be taken. The word that I'm looking for, of course, I can't find at the moment, but succumb. There we go. It's 17 more times more likely that a child could succumb to a sudden infant death if they've always been placed on their back to sleep at home, and then they come to childcare and they get put on their belly, or vice versa. So it's important to be consistent, use back to sleep every sleep. That has been shown to have reduced the number of SIDS deaths over the years since it's been implemented in 1993, I think it was. It has gone down 70%. Use a firm, flat, non-inclined sleep surface to reduce the risk of suffocation, wedging, or entrapment. Feed infants human milk because it is associated with a reduced risk of sudden infant death syndrome. And as I was reading this through this morning with a colleague of mine, we were talking about how, does that mean every child has to have breast milk? No. It's if the family is going to be feeding the child breast milk, then yes, please make sure that they are drinking it while they're at childcare as well, if the mom can express. Place nothing in the crib but the baby. And that means no bumper pads, no blankets, no loveys, all of those things. And one of the things that often bubbles up is, well, mom and dad want them to have their lovey. Well, they will learn to sleep without that if every sleep at the child care, they are allowed to be without it. And so nothing in the crib but the baby is the best practice. And then offer infants a pacifier at nap time and bedtime to prevent strangulation and suffocation. Do not attach pacifiers to any item. Don't clip them to the child. Do not clip them to a rail. Make sure that you leave them without a string or a cord or a ribbon on them. Tracy, do we have a question?
You do. Thank you. Yeah, the question is, infants are placed on their backs but can easily turn themselves over. Would you recommend to turn them back over on their back?
So this is a question that comes up a lot. And it's a question that we've asked Dr. Moon, who is the head of the Safe Sleep Task Force with the American Academy of Pediatrics. So we've actually gone to her and asked her to clarify this point. Um, if a child can roll back to front and front to back, then you do not need to roll the child back over. If the child turns over and they roll from their back to their front, but they don't have the capacity yet to roll from front to back, if the provider immediately sees it's happened, then the suggestion is to gently roll the child back onto their back. But we often know that, the providers may be doing other things at the same time, keeping the child in sight and sound, but may not notice immediately when the child rolls over. So we don't want to panic providers. And that's something that I've had happen before, is that, if a provider thinks, oh, the minute they roll over, I have to be right there and I have to immediately roll them back, it can be very stressful. And what I have found is there's providers who aren't so sure they want to take infants if, in fact, they feel that much stress about how they have to care for that child, and, the sleep piece, and making sure that they're always on always exactly just so. And that stress can cause providers to say, no, I don't want to take infants. So what we recommend is, if they can roll back to front, front to back, let them be. You don't have to do anything. If they roll onto their stomach and the provider sees that, gently roll them back onto their back. So then, that was a great question, Melissa, and one I've heard a lot of times. So the next slide continues the requirements or the recommendations of the Safe Sleep Practice Standard. Avoiding smoke and nicotine exposure, right? Avoiding alcohol, marijuana, opioid, and illicit drug use by the caregiver or teacher. Avoid overheating and covering the infant's head. We used to see that way back when my babies were little. They came out with those covers for the car seats, and people would leave them on indefinitely. And we would always recommend, take them off when you've gotten them from the car to the house or the child care center to the car, so that they can get lots of good oxygen. Avoid the use of commercial devices that are inconsistent with safe sleep recommendations. Another thing that I hear a lot about is these monitors that go on the mattress. They are not guaranteed to work. The best practices, if you follow those best practices, you're going to do everything you can to keep that baby safe. And you want to make sure that you are doing all of those things and not necessarily trying to rely on a commercial device. And the other one that's interesting, and I find that sometimes providers kind of like, well, do I have to move an infant who falls asleep someplace other than their crib? It is best practice to move that baby from the swing or the car seat that they've fallen asleep in into their crib so they can complete their nap. And sometimes that means they wake up, but it is the best practice. It is not a best practice to leave them in their car seat to sleep until they wake up, because you think about when they're in their car seat, and often when they're really tiny, they're hunched over and they're rebreathing that air that is right there in front of them. And that lowers the oxygen levels in their bloodstream. We don't want that to happen. So we want to keep them as healthy as possible. And In some states, Amy says it is a violation of minimum standards if you don't move them when they fall asleep somewhere besides their crib. And I have heard that, Amy, and I think it's really great that it's aligned with the best practices of safe sleep. The other note that's in the safe sleep practices standard is that cribs must comply with the current safety standards set by the U.S. Consumer Product Safety Commission and the American Society for Testing and Materials. So there is a whole nother caring for our children standard that is about cribs. So if you want to learn more over there, you can. And then there is the new crib standard. The crib standard has been updated, includes play yards. So if you want more information on play yards, that is also available within 5.4.5.2. And so you go to NRC Kids, you look up that standard, and you would be able to see what that standard says. So all these practices together make the safe sleep standard. But there's more. So this is new in this safe sleep policy statement that just came out in 2022. For the first time, there was information and language about providing supervised awake tummy time to facilitate infant development and minimize the risk of positional flathead, having that flathead, and place the infant in tummy time while awake, supervised for short periods of time beginning soon after hospital discharge, increasing incrementally to at least 15 to 30 minutes total daily by age 7 weeks. So this is interesting because when I first started out teaching childcare providers, a little bit ago, I had somebody who was a family childcare provider who said to me, "You mean I have to put them on their tummy? I didn't think I was supposed to put them on their tummy. I thought I was supposed to keep them on their backs." And I said, "Oh no." And we talked about the importance of tummy time and what tummy time was. But the regulations and the words that had come out and the marketing that had come out at the time, she really believed she was doing the right thing by always keeping the baby on its back. And if providers have additional concerns about that plagiocephaly, what they can do, that flathead thing, and I'm sure you've all seen infants in the little helmets, what they can do is put the infant's feet against the foot of the bed. So one day they're at one end of the bed, and the next day they're at the other end of the bed. And it seems like such a simple thing, but by changing the direction that the infant sleeps, the infant is automatically going to look towards the door. So if the door's to my right, I am going to turn my head this way. And if I am laying the other way, then it's to my left. So I'm going to turn my head to the left. And this helps round out the back of the baby's head. The other thing that came up in the 2022 standard or statement, was know when swaddling is no longer appropriate. So there's no evidence that swaddling as a strategy to reduce the risk of SIDS. It does not, there's no evidence. So we can't recommend it. It's not part of the practices that we recommend. If an infant is swaddled, always place them on their back and make sure that the provider understands how to swaddle a baby so that hip dysplasia does not happen because they're swaddled too tight. Now, there are weighted swaddles that have come out, or weighted objects, weighted objects within swaddles. These are not safe, and therefore they are not recommended. And when an infant exhibits signs of attempting to roll, which occurs right around 3 to 4 months, swaddling is no longer appropriate because it can increase the risk of suffocation if the swaddled infant rolls to their belly and they can't roll back. So you want to make sure that you're aware of those weighted blankets and those weighted objects, the weighted swaddles, not safe. And if a provider does swaddle, if it is allowed, some states and territories do not allow it, and that's okay. If it is allowed, make sure that if the infant is starting to roll, that they stop swaddling. And I'm seeing a lot of really helpful information in the chat about which states include noncompliance for not taking the child from a sleeping position in something other than their crib and moving them to their crib. We used to call this, and I know when I worked for the American Academy of Pediatrics, we called it buckets. If they're not in a bucket of some sort, if the swing, the car seat, other seat, an activity center seat, if they've fallen asleep in one of those, they need to be moved to the bed so that they aren't just sitting in that. And it's also helpful. Somebody mentioned sleep sacks. And Jamie, I love sleep sacks. My babies used them too back in the day, and they were wonderful. So it is really important to make sure that babies are sleeping safely. So if we look at this next slide, one common question I hear in the field is, what is the difference between SIDS and SUID, or sudden infant death syndrome and sudden unexpected infant death? Well, sudden infant death syndrome is the term used to describe the sudden death of a baby younger than 1 year of age that doesn't have a known cause, even after a full investigation. When a baby dies, the doctors, police, and other experts look at what happens. So if a baby dies in care, it is necessary to include a full investigation. So it is considered a death scene and has to be reviewed before everything gets cleaned up. So when a baby dies, they have to do a full autopsy to check the place, to check and see if there's a reason the baby died. And they review the baby's medical history. Sudden infant death syndrome is a diagnosis of exclusion, which means they rule everything else out. And when nothing else is left, then it becomes a diagnosis of a SIDS death. Now, one thing that has bothered me over the years is I see prevention of SIDS. You can't prevent SIDS. SIDS, which is the sudden infant death syndrome, right? Everything else got excluded. You can't prevent it. They haven't figured out exactly what causes it, although I have seen some really good research articles in the last 2 to 3 years where they're getting close. But they can't for sure determine what that is. And so the umbrella over SIDS, which SIDS is included in, includes sudden unexpected infant death. That's SUID. And so those are all the sleep-related infant deaths linked to how or where a baby sleeps. This could include deaths from suffocation, something such as a pillow or an adult's arm covers the face and nose. Strangulation, something presses on or wraps around the baby's neck or head. Entrapment or wedging, the baby's body or head gets stuck between two objects, such as a mattress and a wall, bed frame, or furniture. These deaths are different from the sudden infant death syndrome, but the overarching term is SUID, the sudden unexpected infant death, which SIDS falls under. So this is a resource that you might find helpful. And thank you so much, Amy, for putting the link into the chat. You might find it helpful to share this with your providers. This is a handout from the National Institute of Health and its Safe Sleep program. And these resources are free and shareable. And many of the resources on their site are in multiple languages. So I think that for someone trying to share this information with a provider who might not be as familiar with what this all means and what is SIDS, and I don't understand why I have to put them on their back, this might be helpful in sharing information about why it's important. Why is it a best practice to do all these things? Ashley, I'm going to turn it over to you so you can share some trends on safe sleep.
Thanks. Okay, let's look at some trends about safe sleep. So our center has tracked the number of states that require babies to be put on their back since 2005. And most states have added this part of the standard to their regulations over the past 20 years. So today, all states have the requirement for centers, and only one state is missing it for each type of home. Research, national guidelines, and campaigns about safe sleep, like the Back to Sleep campaign that Jean talked about, have impacted changes to licensing regulations. And due to this messaging, nearly 100% of states have this life-saving requirement in their regulations. Here's some more data about safe sleep requirements. This chart is showing the other common practices that promote safe sleep that are typically found in licensing requirements. New AAP recommendations in the Safe Sleep for Babies Act might prompt the remaining states to add requirements prohibiting the use of soft bedding in cribs. And also, if you're interested in the states in your region or like states that you're practicing in, you can go to the National Database of Licensing Regulations. And I think we have that link available, but there's also we'll share it for sure at the end of the presentation. So I'll give you just a second to read over this and look at the data before moving to the next slide. Okay, passing it back to you, Jean.
Thank you, Ashley. Okay, so that was safe sleep. So now we're going to look at another standard, and we're going to look how caring for our children breaks it down. And then what does that mean for best practices? So we're going to look at emergency preparedness. And as we think about implementation and development of emergency preparedness plans, are there barriers your providers face in using best practice? If so, what are those barriers to implementing best practice? How does the standard support children and families? And remember to write those down so that tomorrow, when we have that community conversation, we can dig into this a little bit deeper. Okay. So Emergency preparedness, the standard for disaster planning, training, and communication, and the standard for emergency and evacuation preparedness are combined in caring for our children basics. And that's what you see on the slide right now, is you see that particular version of this standard. This standard includes that each program should have a written plan for how to prepare for and respond to emergency situations and disasters, including plans for the following: evacuation. You should decide and document how to safely move the children, including infants and children with disabilities, out of a home or a building. So when I first started in childcare, I was a director. My second job in childcare, I was an infant room teacher. And in the infant room, I was one provider with 4 babies. And I did not have help. So if there was a drill, I had an evacuation crib that was near the door, was on wheels, and it said evacuation crib on it. All the babies went in there. I had I had envelopes for each of them, which you're going to learn why in a minute. And I had the necessities that I needed in a to-go bag and put it in the crib with the babies. And I would push the crib out the door, and that would get us out. And we were through the evacuation. We were able to do the evacuation drills. And I think for the most part, we were able to do it in under like 4 minutes on a good day. So how are you going to move children safely, including the infants, out of the home or building? And providers really need to be thinking about this. And in fact, if they're taking CCDF monies, this is part of what is required of them, is to think of these things. Relocation. So where caregivers and teachers can provide services safely until reunification can take place with children and families. This provision should include bringing children approved pickup list and special health care plans to the location. Shelter in place and lockdown. Okay, so this one, we just recently shared some of this information at the NARA conference. And this particular best practice and item within emergency preparedness was interesting because a lot of people in the room said, what do we tell providers to do for a lockdown or shelter in place? Like, how do we explain what to do? Well, first of all, they need to identify and write down a safe place in the home or the building to shelter in place. But since then, since we know that this is a concern, we had actually done a little bit of research, and we found that the Early Childhood Knowledge and Learning Center for Head Start houses the Emergency Preparedness Manual for Early Childhood Programs. And there's a page in there that specifically walks through what a family childcare provider should consider, and another page for what a center should consider as they think about shelter in place and or lockdowns. So Amy is going to provide those for you. And those are 2 resources I think that you might find very useful. The next item is that staff and volunteer emergency preparedness training and practice drills. So not only do they have to be trained, they have to know how to do the the practice drills, how to take children's attendance during a drill, how to log training and practice drills. they have to be trained on all of the things that are going to happen within the center that are in the emergency plan or in the home in the emergency plan. So keep in mind, electronic records may be inaccessible during an emergency. So you should account for this possibility in the plan. And so we'll go on with the next part of it. Each program should have written plans on how to prepare and respond to emergency situations and disasters, communication and reunification with families. How are you going to communicate with families if there's an emergency or a disaster occurs? When I lived in Northern Illinois, it was tornadoes. If there was a tornado, how would I be able to reach my child's home or place of care to know what happened? Where are they at? Did they get hit? Where am I going? Is everything okay? Down where I live now, we have hurricanes. And so we have to be mindful of what happens with a hurricane. Did a tree fall on the house? Are the roads passable? Am I going to be able to get to my child? So there's a lot of things that occur, and we need to be mindful of those things and really kind of think through what is appropriate to include in our emergency plans based on our region and where we live and what we know could happen. I know that in California, this hasn't filtered down to childcare yet, but in the public schools, they now have to have heat plans. If it's too hot outside for the children to go outside, what are they going to do? What else are they going to do? What is their plan for that time? Because they have to have some sort of plan. There's also continuity of operations. So your providers need to document how to continue providing early childhood services if they're unable to use the program building or the home. And accommodations of infants and toddlers, children with disabilities, and children with chronic medical conditions. So plan how to move children who do not walk and how to evacuate them if they have an individual health plan, medications that they have to have, or equipment that they need to take with them. So Ashley's going to go over some of these trends that go along with emergency preparedness.
Hey, thank you. So the data that we're looking at here in this table are 3 specific activities that were reviewed from the National Database of Childcare Licensing Regulations. As we look at emergency plans, almost 100% of states and territories now require these for childcare centers, family childcares, and group childcare homes. Remember, this is a requirement of all providers who accept CCDF. So if your state and territory isn't there yet, they will be soon. And procedures for natural disasters, power outages, etc., are lower. You can see that on the second line. And then the numbers go back up on the third line for fire and emergency drills. And just like last time, we'll give you just a second to digest the graph. Great, Jean, I'll pass it back to you.
It helps if my mouse wants to cooperate. So we have one last standard in action that we're going to go through and think about. And we're going to talk about personal caregiver and teacher relationships. Now that's a standard that doesn't typically come to mind. You think about, oh, there's safe sleep, there's building, there's safety, there's hazardous materials. Are they putting those hazardous materials out of the reach of the children? And well, what about the relationships? And so we want to make sure that we highlight that this is a standard that is a best practice, even back in caring for our children basics, that fundamental level that was the floor. This is included there. So personal caregiver and teacher relationships from birth to 5 years. What are the regulations and standards for your jurisdiction? As we think about teacher and caregiver relationships, are there barriers providers face in using best practices? If so, what are the barriers in implementing best practice? Write those down. You'll have an opportunity to discuss those and the other topics that we've talked about during the community conversation, which is not tomorrow. My apologies. Thank you, Tracy, for sending me a note so I could get it right. It is on Thursday. So make sure you're there Thursday if you want to talk about this in more detail. We really want to see you. Okay. So looking at caring for our children, 2.1.2.1 and 2.1.3.1, which put together creates this standard. Caregivers and teachers should carry out policies that are based on relationships and program practices that promote consistency and provide the same caregivers for as long as possible, especially for infants and toddlers. You may have heard the term continuity of care. Continuity of care says when infants have the same caregivers over a period of time, instead of changing all the time, the caregivers and the infants are able to build an attachment. They will have an understanding of how each other works, and that relationship will become extremely important. That will become their primary caregiver. So you want infants and young children to build emotionally secure relationships. You don't want to keep switching out the caregivers in a classroom or a teacher in a classroom. Children with special healthcare needs may need additional staff or specialists to promote health and safety and support learning. Relationships are so important to the quality of safe and healthy care. And relationships is how social and emotional well-being is grounded. We hear a lot about behavior and mental health in young children these days. And if they build quality relationships from the beginning, they are less likely to struggle with mental health issues and behavior issues as they get older. So it's really important that we think about these relationships. The second part of this relationship standard is to consider personal space in young children. The Council on the Developing Child emphasizes relationships. Young children experience their world as an environment of relationships, and these relationships affect virtually all aspects of their development: intellectual, social, emotional, physical, behavioral, and moral. It's important to respect children's boundaries and respect the relationships that are built with children. So I'm going to ask Ashley one more time to tell us a little bit about the trends related to relationships.
All right. So here we're looking at the trends related to relationships. The percentages are similar in the requirements about interactions and relationships, but the actual requirements vary widely across the states. So having a primary caregiver for infants, which is someone who is assigned to a specific child to care for first, is seen mostly in center regulations where there are more staff in the program. It's really not applicable in family child care homes since there's typically only one caregiver. And in a group child care home, which is typically two caregivers, we just don't see this as much in standards. For the second line, interactions and relationships with infants and toddlers, we look for things like responsive caregiving in the regulations. And for all ages, something like this states language. This is an example. I might say something like, provide opportunities for a child to develop a caring and nurturing relationship with and attachment to one or a small number of caregivers whose care for and responsibility to the child ensure relief of distress, experiences of stimulation and comfort, and satisfaction of the need for a connection with the child's caregiver. And we see that although, that's the end of the quote, and we see that although this is very important to a child's mental health and well-being, it's actually not as elevated in licensing requirements as some of the other standards we've looked at today. So I'm just going to give you a couple seconds to look over this, then I'll pass it back to you, Jane, and we'll get ready to close out pretty soon.
And Tracy, I see you. And I know that must mean there's a question.
There is. Karina had a question, and I don't honestly know if this is a question you want to talk about today or if we want to have this at the community conversation on Thursday, because I think it would be interesting to hear from other folks on the phone. But the question is, to effectively implement this standard in centers with high turnover rates, what strategies should be employed? And it's a great question.
It is a great question, and it is a constant question, especially with centers. We know that it used to be, and I haven't looked at the data recently, but I know it used to be at least 30% turnover at all times. You know, it's a constant struggle. And one of the things that I would say is that we know that it doesn't necessarily have to be the teacher in an infant room. It might be the assistant that has built the relationships and maybe has been there for a long term. So if you can keep at least one person in a room consistent over time, that benefits all the children that are in that classroom. That isn't always doable, and it is not a solution by any means. But I would love, like Tracy said, to hear from other states and other folks, to hear on Thursday what folks are doing about that. You know, how are you trying to keep that continuous care going in the centers with high turnover rates? So Karina, I really appreciate you bringing that up. And I also appreciate that you all found the correct link to the those documents, because I don't know what happened, but I'm glad that you have them. So I will leave that there for now so that we can talk about it on Thursday. One last thing that I wanted to bring up to you, and it's something that you know, I work with Region 9 states. I have a state out there that we talk about this piece, right, about technical assistance versus monitoring. And a strength indicator that reflects best practice for regulatory agency performance includes the following: effective provider support services designed to promote providers' knowledge, compliance, and accountability. The services emphasize compliance-related technical assistance and workforce development. And this is from a paper from Amy Lapp-Payne, who wrote a paper in 2011 around strong licensing, the foundation for quality early care and education systems. So in addition to conducting evaluation inspections while monitoring child care providers, child care licensing staff often support childcare providers by offering technical assistance. Either they may refer the provider to technical assistance, or they may be able to provide it themselves. And when you provide technical assistance, it helps providers understand about childcare safety and health, quality, and child development to be available for provider questions. That's part of technical assistance, to provide access to information about other state and locally funded and administered programs that support childcare facilities. So let me give you an example. Technical assistance as an enforcement action. So there's one state that includes technical assistance as one of its licensing enforcement actions. By doing so, it communicates a value to the provider of continuous quality improvement, always trying to come into what is best practice, right? And then another state has a licensing technical assistance manual for providers on licensing rules. So you have your licensing rules, but then there's a technical assistance manual that says, here, if you're struggling to understand what I'm supposed to do with that licensing regulation, you can think about going to the TA manual that explains, oh, that's how I'm supposed to implement that. That makes sense. And then we have shared a lot of information. We've given you a lot of information to think about, to kind of digest. You are going to have access to these standards. You should know how to find Caring for Our Children, know how to find Caring for Our Children Basics, so that if you have a question about a standard, you know where to find the information. We've shared a lot of information about best practices, standards, and regulations. In order for providers, children, and families to thrive, which we'll see on the next slide, we need to consider where they live, the policies that impact them, and how best to support health, safety, and well-being. One area we didn't discuss today, but is absolutely crucial to thriving, is the importance of personal wellness. And that means not only the providers, but also all of you. We hope we've given you food for thought and encouraged you to participate in the community conversation. The next slide provides you with additional resources. So you can see here, the top resource is the link to the Caring for Our Children database, where you can go and explore all of the standards. The next link down is Caring for Our Children Basics Health and Safety Standards Alignment Tool for Child Care Centers and Family Child Care Homes. And that will be updated as soon as Caring for Our Children Basics is updated. The next one after that is the special collection. And that is on the same site as the database, but they do have a special collection for safe sleep. They have a special collection for children with special health care needs, and they have a special collection for standards related to eating healthy. And so one of them is the safe sleep one, which is at the bottom there. And the next slide, you see that there is stepping stones for Caring for Our Children, which is accessible as well. That's stepping stones to Caring for Our Children compliance comparison checklist. So I've had states that have actually taken that checklist that that reduces morbidity and mortality, reduces a child being harmed and or having an unhealthy lifestyle, and comparing it with their licensing standards and seeing where are the differences. And then the Office of Early Childhood Development, Caring for Our Children Basics, Health and Safety Foundations. The last set of resources, which is the next slide, is Caring for our Child Care Technical Assistance Network. There is a Safe Sleep Safe Sleep video that you can go and see. It was a webinar that we did with Dr. Moon, and then Dr. Moon, the Safe Sleep related policy statement. So I'm going to pass this back to Tracy. She's got some important information to share to wrap this all up.
If I can get my mute button off, I'd be happy to talk. Technology. So thank you both, Jean and Ashley. That was wonderful, extremely informative. I know that you've given folks a lot to think about. There's been a lot of good dialogue in the chat. I think especially the discussion about the standards is helpful for licensors as they're out in the field trying to explain the why of the requirement to a provider. I was a licensing inspector. I know sometimes they don't want to hear because the rule says so. While sometimes that's the facts, sometimes you have more information that you can share. So hopefully this has armed you with a little bit of that information and where to go find other resources so that you can help your providers better understand the why behind the rule. And if you're a policy writer, same thing. The Caring for Children information might be useful to support the inclusion of specific language in your requirements as you're trying to add some things, a justification as to why you want to add that to help someone who's not embedded in those rules better understand why you want to include it. So I'm hoping that you will join us on Thursday for our community conversation. Amy did drop in the chat the registration link. We're also going to email it to you if you were on the session today. But one thing I do want to say about these community conversations, they're limited to 100 people. And we're going to break you out into groups, into small groups, so that you have an opportunity to talk. We're not going to talk to you. You're going to be off mute. You're going to have an opportunity to say, well, how do you handle this? Or what did you do about this? Or what do your regulations look like? Or what do you do with a provider when they won't let you, do whatever? So I hope that you'll join us for those. They have been extremely helpful for folks that have attended in the past. So also a reminder, if you joined by phone today, please drop your phone number into the chat so we can match it up with your name for your certificate. And you can send that privately. You don't have to publicize that. You can send it just directly to the host and panelists by choosing host and panelists from the dropdown. And I think the next slide, we are ending 10 minutes early, which is perfect. We want you to have time to complete a very quick 4-question survey. It'll pop up as soon as you exit, and then you also have a little bit of time in case you have a 2:30 or whatever time zone you're in before you have to move on to your next appointment. So thank you very much for completing the Zoom survey, for attending today. I do want to say this is our contact information. If you have any specific questions or you want to request additional technical assistance support, you can send it to to that email address. And I mentioned we'll be sending out certificates. They will be generated based on your registration information and the email address that you provided at that time. And due to the number of participants, it will take a little bit of time for us to process those, but we will hopefully distribute them within the next couple of weeks. If you don't hear from us, you're welcome to send us an email and we will definitely follow up. And we greatly appreciate your patience with that process. Also, a reminder, the recording of today's session, along with the slide deck, will be posted on the website when they are available. And you'll be able to have access to those URLs that we posted in the chat also. And then as we close, I would like to thank Ashley and Jean for your fantastic presentation, and Amy and Ashley for your support throughout the session with slides and the chat and keeping us all moving. It does take a village. I would especially like to thank all of you for attending and for being engaged today. And I look forward to talking with you on Thursday at our community conversation. So thank you and enjoy the rest of your day. On the last slide, there is a link to subscribe to the Office of Child Care announcements. Amy's going to drop in the chat the URL for that as well. So if you're not signed up for those and you're interested in getting them, we'll have that information in the chat for you. So thanks, everybody. Enjoy the rest of your day.